Okay, so on today's episode, I have a lovely guest here with me. Her name is Dr. Melissa Lee Agawa. Did I say that correctly?
Yeah.
Yes, and she is the owner of Grace and Glow MD, which is, well, I'll let you explain kind of what your practice is and maybe your origin story, like how you got to be in this space.
Sure. So again, my name is Dr. Melissa Lee Agawa, and I'm the owner of Grace and Glow MD. I've been a board certified gynecologist for over 10 years, almost 15 years. So taking care of women like through all life stages, your community OB-GYN, you're coming to me for your pap smears, you're coming to me to deliver your babies, you're coming to me for your surgeries. And I always felt there was something sort of lacking, that I wasn't treating myself or treating my patients enough. Like there was something missing. There are certain things that women would complain about, and I'm like, I don't have a solution for you. I can send you here or I can send you there, but I don't have a personal solution for you. So in about 2 years ago, 2023, I decided to open my own practice, Grace and Glow MD, and the inspiration really came from that, my patients, what's missing. Grace and Glow MD is a women's wellness and a medical aesthetic practice. So all things to make you feel better, look better. And the one thing that I do mostly in this practice is helping women with intimacy issues, bladder control issues with modern technology. Believe it or not, this modern technology, I didn't even know about it a few years ago. And they certainly did not teach us this in residency.
Interesting. Really?
Yeah.
Okay.
We maybe touched upon it, but it was not mainstream. So we can start diving a little bit deeper in those treatments, those symptoms that I treat. But let's just start with something really easy, right? Bladder control.
Yeah. If I can jump in here quick, I was looking, it seems that I think it's like 30 to 40% of perimenopausal women have urinary bladder issues, and even greater than 50% postmenopausal. So like a lot of women are dealing with this. We're not really talking about it too much.
Right.
So that's why I think this is the perfect topic for this podcast too, because my whole idea of Pretty Wise is all the things that you need kind of as an aging woman to keep you feeling and looking your best. So I think urinary incontinence is a huge thing that I would love to hear more about. So
Yeah. So
tell me the types. How does it work? Yes.
So I mean, you've quoted some numbers, and I would have to say almost about 70% of women at some point in their life will have experienced urinary incontinence, whether you're newly, freshly postpartum in your 20s or 30s, or now you're 80 and 90s, you're in that nursing home and you're wearing your Depends, right? So it spans through a whole lifetime of women that this can happen. And certainly there are different types of urinary incontinence. One of the most common types of urinary incontinence is stress incontinence, right? So a lot of my patients will say, well, I can't do a jumping jack. I can't do a HIIT exercise. I can't jump on a trampoline with my child. I had a really bad cold the other day and I just kept peeing on myself because I kept coughing. Like, this is stress urinary incontinence, and it happens to a lot of women. So we can dive a little bit deeper into why this happens.
Yeah, let's talk about why.
So there are many risk factors, right? Let's dive into the root cause, right?
Okay.
The root cause of bladder control is that our pelvic floor muscles and our vaginal tissue have to be strong and healthy to support the bladder. If the muscle starts giving up, it starts weakening as we get older, you're not working that muscle out, it's not supporting the bladder neck. So when you jump, sneeze, and cough and that bladder neck starts moving around, that's actually when the urine comes out. And then what we don't really talk about is the vaginal health, right? You're like, what does my vagina have to do with my bladder?
Yeah.
And the anatomy is that they're neighbors. The bladder and the vagina are neighbors. So if you don't have strong, healthy tissue in the vagina, you're at risk for less bladder support. Your bladder may drop. I'm sure a lot of you women have heard, your prolapse, right? Your mom, your grandmother talking about it. My bladder's coming out of me, right? So vaginal tissue is also very important. So the modern technology that I have in my practice comes from a company called InMode, and they're a company based out of Israel. They're their research and development is wonderful. They're kind of like I don't want to say the god of radio frequency, but they're very good at the radio
They make
frequency
Morpheus, right?
technology. Yeah, Morpheus. Like everybody knows Morpheus, right? Because Kim Kardashian got it, right? So everybody knows Morpheus 8. But did you know Morpheus works in the vagina too? So anyway, so let's kind of break this up a little bit. So let's talk about the muscle and the pelvic floor. So as a gynecologist, I have to say, like 15 years ago when I was training, no one really talked about the pelvic floor. No one knew how important it was. You couldn't even really find a pelvic floor physical therapist anywhere because it wasn't really a thing.
Interesting.
Back then, when people had urinary incontinence, everybody was getting sent for surgeries. They're getting bladder sling. They're doing all of that. They're being sent home and say, hey, go home and do your Kegel exercises.
Or medication too, right?
There's medication is more for urge incontinence or overactive bladder rather than the stress incontinence. The stress incontinence is more of the anatomy.
Okay.
So anyway, so back then it was really a thing. So I'm happy now I can easily find a physical therapist to help my patients, but the pelvic floor muscle is so important. I wish I brought my diagrams.
I know.
Usually when I do a consultation, I actually have a diagram and actually show my patients like the anatomy, why this is happening. But the pelvic floor muscle actually supports your bladder, it supports your vagina, and it also supports your rectum. So a lot of people, when they activate their pelvic floor muscles doing a Kegel, they're activating the wrong muscles.
That's what I heard. Yeah, I was going to ask you about that. Yeah, we're doing them all wrong. We're doing
it
Kegels
all wrong.
Yeah.
Oftentimes when I ask my patient to activate their pelvic floor muscle, they're trying to like lift their butts up and squeeze their glute muscles. I'm like, if your butt's lifting off the bed, you're not using the right muscles.
Right.
It's more of these internal muscles. So what do I do? So I have a device called V-Tone. We use electrical muscle stimulation, that technology, to stimulate and contract those pelvic floor muscles. And pelvic floor muscles is like a conglomerate of different muscles, not just one muscle. And it's amazing when those muscles get activated. A woman is like, I didn't even know my pelvic floor can do this.
So you feel it?
You feel it.
It's definitely a sensation?
It's a very strong sensation.
Interesting.
It's not uncomfortable, but it is very weird.
Okay.
It's like your whole pelvic floor kind of just,
Yeah.
and then it kind of relaxes. And we do the session for about 30 minutes. And believe it or not, 30 minutes equals to about a year's worth of effective Kegel exercises. And I truly believe it. I mean, that's what the company was selling me. That's the company what they were telling me about. And I'm like, but now that I've done so many of these treatments, I'm like, this is a fact. I had a patient the other day. She had urinary incontinence, mainly stress incontinence, pretty much her whole life. Like before she had children, worse than after she had children. And she kind of just lived with it. She said, I'm using all these over-the-counter Depends, pads, all these things, and I'm soaking them. I keep changing them. And the sad thing is she was only in her 40s. She wasn't even like that 80-year-old in the nursing home. She's in her 40s. She's on the soccer field with her kids. She's a soccer coach, and she's like, I'm peeing myself while I'm on the field. So she came in, and she did one session of the V-Tone. I evaluated her. I told her, this is your treatment plan, but let's just start with one and see how you feel, see if you want to come back for more treatments. So she did her treatment, and I didn't talk to her for a few weeks. I'm like, is she coming back? Is she not? And then she shows up on my schedule, and she came in, and she was so excited to see me because she said, I couldn't remember the last time I needed to change my pad. I wear it, but I wasn't changing it that often anymore. And that was just one treatment.
Wow.
She stayed dry.
Wow, that's amazing.
So it's just amazing to hear how you can change a woman's life.
Yeah. How many treatments does one typically need to get results?
So typically anywhere from 3 to 6 treatments. I do have women who will get significant relief, just like this woman, with one treatment. But it's muscle, right? You have to work it.
Work it out.
You have to work it out.
Yeah.
You have to maintain it.
Yep.
So a lot of my women that go through a treatment series with me will have anywhere from 70% to 100% relief of their symptoms. But if I say, if you don't do your exercise at home, or if you don't come back for maintenance treatments or maintenance therapy, then you might go back. right? It's a
Right.
muscle.
It's just like any other muscle.
Just like any other muscle. You don't work your biceps, your triceps, your chest muscle, you're not going to be able to lift as heavy as you get older.
Yeah. Have you ever heard this idea that, when you're doing your Kegel, instead of, like you said, lifting everything, it's kind of imagining pulling a tissue out of a tissue box with your
kind of
vagina?
like with your like you squeeze, like I'm trying to do it right now. Like,
yeah, right. Just like a little gentle. It's not that what we used to hold it as hard as you can and as long as you can and then release. That's not really.
It's really just recruiting all those muscles in the pelvic floor, but a lot of women don't know how to do it.
Yep.
And that's when I'm like, I give props to my physical therapist because they teach them how to do it.
Yep.
There are some people who can't, like you teach them, they can't recruit those muscles, they can't fix it. And those patients are great for me to treat because then I have the device to do it for them.
Got it. Okay. So they would come to you because they're having symptoms, and then based on the severity or like their history, you would decide whether they needed the V-tone. Are there other options?
Yeah.
Or is it just the V-tone? Okay.
Yeah. So let's talk about the vaginal tissue, right?
Okay.
Because we said the muscle and the vaginal tissue are two very big components.
Yes.
They're neighbors. They help bladder control.
Friends. Yeah.
So vaginal tissue. So this blows people's mind all the time. There's collagen in your vagina. Everybody's so focused on collagen in their face, their skin, their hands, right? But people don't think about the collagen in their vagina. So as you get older, you're losing collagen or becomes bad collagen. Then you hit menopause, you lose your estrogen, right? Estrogen, we all know, do great things for us. Estrogen helps supports the thickness of the vaginal tissue, helps supports the blood circulation that goes into the vaginal tissue, supports the lubrication. You lose that, you're not supporting the health of the vaginal tissue. So all those things naturally happen as we get older. If you popped out a few babies like me, I have 4 children. Every time a baby comes out, you're damaging the vaginal tissue.
What if you've had C-sections? Does that not affect it as much?
So you don't have a baby busting out of your vagina, but that weight of the pregnancy, right? You're carrying this baby, this weight is pushing down on your pelvic floor, pushing down on your vaginal tissue. It does damage. It does damage and weaken the pelvic floor and your vaginal tissue. So oftentimes I'll have a woman come in and say, I've never had a baby or I've only had C-sections. Why am I getting all these symptoms? Because we do get older, right? These are natural things that happen. So back to the vaginal tissue. So I have 2 technologies that help reverse the aging vaginas, basically making the vagina younger again, like thicken up that tissue. We use technology called radiofrequency, and by the device name is called Forma V.
Okay.
And then we use radiofrequency with microneedling, this is your Morpheus 8V, right? Everybody knows about the Morpheus for the face.
Yeah.
Morpheus 8V is for the vagina.
Ooh, is that painful? I've had Morpheus on my face. It's not pleasant.
The vagina numbs very well. So just like you numb for the face, you numb for the vagina. The vagina numbs very well. I actually had this treatment done myself actually a few days ago because I was training some girls to do it.
Okay.
And, they needed a model. I was like, please work on my vagina. It's not painful at all. I didn't feel it. It felt like pressure. Didn't feel the needles at all. Very comfortable treatment. Quick treatment. Takes about 10, 15 minutes to do. So oftentimes people will ask me, like, why one treatment over the other? Sometimes it's not just one treatment over the other. It's a combination of the treatment. It's both. When you do both treatments, you get better results. But this is how I break it down for some people. Like, radiofrequency by itself helps fix your existing collagen and elastin, making them stronger so they can produce lubrication. It also does radio frequency itself will bring blood flow back to the vaginal tissue, making it healthier. So for some women who have vaginal dryness itself, the Forma V is an excellent treatment for it. When we go to the Morpheus 8V, now I'm looking at, like, does this woman have vaginal laxity? Does this woman have bladder drop? Does this woman have, their rectums pushing into their vagina? Like, is there tissue that's damaged?
Okay.
So now I'm using the Morpheus 8V to tighten up the vaginal tissue by really producing new collagen, right? When you put needles, you're into the tissue, you're causing microtrauma, controlled
Just
microtrauma,
like on the face.
right?
Yep.
Just like on your face. And when you do control microtrauma, you're producing collagen. So you're doing that same thing in the vagina.
That's awesome.
Yeah. And I would say I haven't had a failed treatment yet. It's so crazy in medicine how, like, even when you do surgery, you can't promise somebody that you're going to fix them 100%. But I can confidently say that these treatments, you will have improvement to the point where you may not need to use lubrication anymore. You may not need to take medication for urge incontinence. You may not need to use estrogen, you know, things like that. Like, you know.
Is it instant or does it take, you know, weeks to months to see?
That's a very good question. So as we know, like collagen building takes about 3 to 4 weeks, right, for that collagen to build. So most of my patients are feeling the difference in terms of like the vaginal lubrication and the tightening within 3 to 4 weeks. For the muscle, the V-tone, a lot of my patients are feeling that within a week.
That's amazing.
Yeah, they literally walk out of there feeling stronger.
Do you like concurrently use estrogen, vaginal estrogen as well? Yeah,
I do. I am a big supporter of vaginal estrogen. If you know, all my postmenopausal women want to be on vaginal estrogen, I would give it out like candy. Now that they've lifted the black box warning, right? So I do use it as in conjunction to these devices, but I'll tell you, I've treated a lot of vaginal dryness in my career, and I treat them in the traditional way, right? Like I'm saying you need to use vaginal moisturizers, vaginal lubrications, vaginal estrogen, and a lot of them become non-compliant. They don't like it, right? It's messy. I have to do it twice a week.
Right.
Oh, I went on a trip.
Right.
I forgot to bring it.
Yep.
And when I don't use it, it goes back. And when it goes back, then they're kind of telling their husbands, no, thank you, I can't do it tonight. So it becomes a hurdle for a lot of women to overcome when they have to use something. But with the technology, you're reversing everything that's happening that's gotten to that point.
That's pretty awesome.
They can end up using less estrogen, less lubrication.
Wow.
So.
And you've brought some things.
I did. I brought it for show and tell.
I just want to see like how wide it is.
So this is our V-tone device right here. This is the electrical muscle stimulation. So this does
that whole thing is going.
This goes in, gets inserted into the vaginal canal, and these panels here, emits the electrical current, and it stimulates and contracts those pelvic floor muscle. So I'm actually monitoring this as my patients are getting the treatments, and you can see the pelvic floor kind of suck in, like wink at you and kind of relax. And it's so satisfying because you're like, it is working.
Something's happening.
It's happening.
Yes.
And my patients feel it. So we do this for 30 minutes, anywhere from 3 to 6 times, and people do feel a big, big difference.
And that one you don't need to be numbed for. That doesn't hurt. Okay.
Nope, this doesn't hurt. I don't numb.
But not painful.
Yeah, it's just weird. A lot of my women will come in during lunchtime, bring their book, bring a podcast, and it's 30 minutes, and it goes by quick.
I bet. Okay.
Very
cool.
easy.
Excellent.
So we'll move on to the next one. This is my magic wand here. This is the Forma V. So this is just radio frequency. So you can kind of tell like the size difference. This is very slender compared to the V-tone. So a lot of older patients, and I don't know if you guys all know this, but in postmenopausal patients, the truth is if you don't use it, you lose it, right? So I have seen a lot of vaginas that are shrunken, very slender, that it's also very difficult for me to examine. So this is slender enough for most women that I can insert this inside to help heal their tissue and make it more elastic again so that they can enjoy intimacy again. So this typically is about anywhere from a 10 to 30 minute treatment. We can actually treat the inside of the vagina, and you want some skin tightening on the outside, this does it too. Kind of like, remember radio frequency for your face?
Yeah, sure.
You can do radio frequency for your labias.
Oh, interesting.
So remember, who was it? Who's the comedian? Ali Wong? When she was talking about like post-baby where she felt like her labias were hanging down.
Oh, God, yes.
Like this will actually tighten up the skin.
Okay.
So there is functional and cosmetic components of the Forma V.
Got it.
So this is, like I said, just the radio frequency. Comfortable. It really doesn't feel like anything. If you've had a transvaginal ultrasound, it kind of feels like that.
Okay.
So our last modality is the Morpheus 8V. Here it is. This is sterile, has needles in there. And this is the one that I say it really creates the collagen for you, really thickens up that tissue, give that lubrication back, try to help that bladder drop things like that.
That's
so
amazing. Can I see that?
You
I
can
just
see
wanna
that.
the needles. I do
They're
that
inside.
needling in my office all the time.
Yeah, they're all inside, gold plated,
They come out
24 needles,
just like a regular,
just like a
microneedling
Morpheus.
pen. Yeah.
It's literally the Morpheus 8 for the face, but in a different handle.
Got it.
Yeah,
Makes sense.
It
I
makes
love
sense. Yeah.
So this is stress incontinence. What about urge incontinence?
So
I have
urge
some friends.
incontinence, I find that like not everybody has straight up urge incontinence. When you say urge incontinence, it could be like overactive bladder. And overactive bladder stems from the brain and the nerves or misfiring, and it's causing your bladder to misfire and start spasming, right? And that's when you're like, oh, I gotta go.
Yeah.
So that's why it's usually treated with medication. And because medications relax the bladder so that even when it fires, it's trying to relax rather than contract. So it doesn't give you that feeling of, I gotta go. However, most incontinence can be mixed incontinence, right? What is mixed incontinence? It's a little bit of overactive bladder and a little bit of stress incontinence, right? So my treatments will help women when they say, you know, I gotta go. I can't hold it. So maybe they do have a little bit of overactive bladder, but they also might have a weak pelvic floor. So when their bladder's firing, they're like, I can't make it. I'm peeing on myself. Well, you got to fix your pelvic floor to stop it from coming out.
Makes sense. Yeah.
So that's mixed incontinence. So you have a little bit of both now.
Yeah. Right. Okay. Yeah. I think too, some of my friends have said too, like it's that sensation of like, if I don't go right this second, and it's new and during like perimenopause and menopause, like this is something I've never had to deal with before. It's like, if I don't find the bathroom in the next 15 seconds, it's going on the floor. Yeah. So I wonder if it's a combination for them.
It's
as
a
well.
combination, but honestly, a lot of those symptoms get resolved with my treatments. A lot of my patients will say, you know, I gotta go. And before, I couldn't even get my pants off and I would start dribbling. But after your treatment, I'm able to hold it until I get my pants off.
Right. Because I have the strength.
So now I have the strength to do it.
Yep.
True bladder, overactive bladder, these women are like needing to go to the bathroom every 15 minutes, waking up in the middle of the night multiple times to go to the bathroom, or when they have that really, they're constantly having a very strong urge to go. So that's true urinary incontinence. So during my consultations, a lot of it is try to piece it out of my patients or tease it out and say like, okay, does she have stress incontinence, mixed incontinence, or just an overactive bladder?
Right. Or is it a UTI?
Or-
you know, right?
Sure, yeah.
So that's why it's so important to make sure you're going to a medical professional like you to get this treatment, because you really have to rule out other things before you just assume it's muscular. You know?
Right, exactly. You got to figure out what the root cause is.
Yeah.
Then you can treat.
Yep. Now, what about men? We didn't really talk about men at all. Do they have issues with their incontinence? Is a little different, and that's usually older men.
So
Are there younger men that struggle with this, or is this really a female issue?
I mean, so let's look at the anatomy of a man and a woman, right? So the length of the urethra, men have something called a penis, right, where it houses the urethra. So, and it's outside of the body. So when a man jump, sneeze, and cough, that pressure is not affecting the penis because the penis is on the outside.
Yeah.
For a woman, majority of her urethra is on the inside of the body. So if that urethra is not being supported, that's where you get incontinence. That's why it's so common in women. Now here, remember I talked about the pelvic floor supporting your rectum. A lot of men, as they get older than, you know, in their 70s and 80s, they can have fecal incontinence because they lost strength to their pelvic floor. So that's kind of when that happens for men as well.
Got it. Yep.
Yep.
And obviously, you don't see men in your practice because you're a gynecologist, right? So you don't even
Yes
treat
and
men for.
no.
Oh, what was the story? You were going to tell me a story. What's
So
the
yes
story?
and no. So I've been so inspired by this platform of modern technology that I could help women with. And women will start talking to me about their husbands and saying like, because I would ask them like, are you having sex with your partner? It's like, it's not that I don't want sex. Is that he's having issues himself.
Yeah.
Right? So what I've learned in this whole process, because I deal a lot with sexual health, is that men have their own issues, right? Erectile dysfunction. What I didn't realize is that it's just as common as urinary incontinence. 50% of men, by the time they are in their 50s, will have some form of erectile dysfunction, whether they can't become spontaneously erect or maintain an erection. And it's the same root cause: blood circulation and collagen. So if we want, we can talk a little bit about the anatomy for men.
Yeah, sure. I mean, we have loads of time. Loads of time.
So, how does the penis work, right? How do you get erect? You need blood flow. So the blood flow goes into the penis, but it has to stay there. If it doesn't stay there, they can't maintain the erection. How does it stay there? The penis gets engorged, and the tissue around the venous drainage, so where the blood comes out, has to squeeze, has to shut off that drainage. But if that tissue is not strong enough, it's just going to drain the blood out of the penis. So then they can't maintain their erection. So that's sort of the root cause, blood flow and tissue.
Okay.
So when I saw how radio frequency helped my patient, because it is a blood flow tissue issue for women, then I'm like, it's got to work for men. So the same company InMode thought the same thing. They came out with a device called Apex. And Apex is just radio frequency. We're not needling any penises.
Okay. I don't think any men would.
No, they would not. They would not sign up for that. But it's just radio frequency. It's a very comfortable treatment. It's a 15-minute treatment. And we are doing just applying the radio frequency energy to the shaft of the penis. And we are finding that I'm still used to talking about women, but men are using less medication. They're using less Viagra, Cialis. They're not going out there and be creative and trying to maintain their erection.
Yeah, using online.
Whatever they're using. But you hear all kinds of story from men because they get desperate, right? It's their manlyhood. But I recently treated a man. Well, I've treated a few men, but I finally completed a treatment for a man.
Okay.
And one of the selling points of this company was, okay, you don't necessarily have to treat men with erectile dysfunction. You can treat a normal man who has no issues, because what's going to happen is they're going to perform better and they're going to be bigger. Who doesn't want to be a couple centimeters bigger, right? And I'm like, no way, you're not growing a penis here. You're not growing a bigger penis. So I treat this man. He truly has erectile dysfunction. So throughout his journey, he's like, I'm using less and less medication. I'm able to maintain my erection. That's awesome. Like, functionally, we are fixing you.
Yes.
It's amazing.
Good.
He's like, nothing else ever worked before. This is the only thing that's been working for me. At his last treatment, he's like a little shy about it. He's like, I think I'm bigger, but I'm not sure. He's like, I think I'm definitely bigger when I'm erect, but I'm not sure when I'm flaccid. Well, guess what we did in the beginning of his treatment? I measured. I measured him. I had taken pictures. And I was like, well, since this is your last treatment, we could take pictures now, measure you, or we could wait a couple weeks and let the treatment sort of completely finish and let that collagen build and then take pictures. He's like, no, let's just do it today. I'm like, great, let's just do it today. So we go and I take out the measuring tape and I measure him and I took pictures, not knowing what my pictures looked like before.
Right.
And then I put them side by side. He had grown a centimeter bigger lengthwise and girthwise. And this is on a flaccid penis. So I can only imagine if he was erect.
Right.
So the company was telling the truth.
That's amazing. Once the word gets out that it's able to do that for men, I feel like they're going to love that. It's
I mean, not only if it's functional, but just giving that confidence back to men. For sure. So there was a day, literally, I was just treating penises all day. Wow. And the conversations I had with each man were very interesting.
Yeah, I'm sure.
One of them, like, they're really self-conscious, They're like, how was I compared to the other men? I'm like, we don't compare, you guys.
That's right. You think we're sitting in the back, like, sharing. Right, we're not.
We don't compare. Yeah. We don't compare. You're here for a treatment.
That's funny.
So, I mean, I think this is a game changer. Radio frequency is a game changer for sexual wellness.
That's great. Do you have physical therapists in your staff, like a PT specialist?
I don't.
I
don't have on staff, but I'm very lucky where my office is part of a whole wellness suite. So I do have physical therapists there.
That's great.
That I refer to.
Okay.
And they cross refer. Like they have a difficult patient, they'll send them to me. Or if I'm like, I finished their treatment and they can't activate their muscles, go there, go learn.
And where is your practice for those that don't already know? And
so I am located in Springhouse, Pennsylvania. So not everybody knows where Springhouse is, but if you know where Ambler is, that's where I am in Montgomery County.
Fantastic. Okay, great. Yep. And you see patients, right? It's not like you have an NP or PA with you.
I
like
see
you're the
my
one seeing
own
them?
patients. I
That's
do my
excellent.
own consultations. My consultations expect to spend about an hour and a half with me.
Wow.
So it's not like you
That's
go to your
unusual.
doctor, right?
Yes.
Where I used to spend 10, 15 minutes with my patient. I'm like, what do we even talk about?
That's amazing. So they get you for an hour. And,
Yeah.
it's a good idea if you're even having any issues whatsoever to meet with you to see, is it something happening up in the brain or is it really something related to childbirth or your tissues, right? To see what's really going
Absolutely.
on.
Well, you actually brought up a really good point. A lot of women don't even realize that it's happening to them because it's been normalized. So one time I had a woman come in and I was just telling her what I do. I wanted her to help, spread the word to her clients because she had, women in her 50s or 60s. And I explained to her what I did. And she's like, well, thank God I don't have those issues. I'm like, that's great.
Yeah, awesome.
That's awesome. But statistics tells me otherwise. So then she comes back. I said, you know what? Even though you don't have any issues, just come back for a treatment. Come back for a treatment because it could be preventative. So she comes back a few weeks later. And I think because I put the idea in her brain, she goes like, guess what? I was at my trainer and I was doing my workout. I must have not emptied my bladder and I went to go lift and I peed myself. Here I'm telling you that I didn't have issues.
See? That's right. Right. Yeah. And it's not something people are open to talk about just casually, right?
No.
Like it's like embarrassing for a lot of people.
Yeah.
I will say too, in my practice, so I don't do anything related to pelvic floor other than I'm working on a menopause certification so that, it's just more front of mind and I'm able to educate my patients on it. But it's amazing how many times someone will come in to fix wrinkles and, vanity reasons. And the conversation inevitably turns to all the other things that come along with being 40, 50, 60.
Yeah.
And so many of my patients have said to me, like confidentially, like, I'm having issues. Like I've had 4 babies or 2 babies. And it's embarrassing, but I have to tell someone. So now it's awesome that I have someone that I can actually say, I know what can help you.
Yeah. And my office is not that far from yours.
Yeah. So I'm in Wayne and you're in Spring House. So it's probably about
On the turnpike, probably 20, 30 minutes.
20, 30 minutes. So
very
that's
easy.
amazing. Great.
Yeah.
Thank you so much for talking with me and sharing with the listeners here all the wonderful
Absolutely.
things that you do. And hopefully we can talk again in the future and see what else things you've got coming.
Oh, yes.
Are there other things you're thinking about bringing on or?
Not right now.
Okay.
I'm really want to focus on the sexual wellness and like helping women in a different way. That's really what I want to focus on in 2026. So, I really appreciate you bringing me on today because it's really giving me a platform to help spread the word.
Yeah.
I am happy to speak to, a group of women. If a group of women call me and say, hey, you know what? Can you just come? I got 20 friends and I
like
want
a girls'
to just
night.
a girls'
Yeah,
night. I'm
yeah.
happy to come and just talk
That's
about
a
it.
great idea.
Yeah. I actually hosted one the other night and I only allotted probably 2 hours for the event in my office. And we ended up talking for 3.5 hours. Because there's
surprised.
so many
Yeah.
questions.
Yeah. And once they get your ear, they want to tell you and want to hear all your thoughts, I bet, right?
Yeah. I was surprised. Like most time I host events, people are sharing their stories. They actually had legit questions. Like, they were asking me all the perimenopause, menopause, and, the anatomy and everything.
That reminds me, one parting thing before you go. So what can we be doing at home to help? You said that there are exercises you can do at home other than, the traditional Kegel, which we know maybe isn't the best way to treat. What are some things that I can do, without seeing you or in addition to seeing you?
So a lot of people think the pelvic floor muscle is just Kegels. There's actually a lot of exercises outside of that that can actually inadvertently activate your pelvic floor. I usually refer my patients to a website. It's oh my God, I'll leave you with the website that you can share it with your clients as well.
That would be
But a
awesome.
lot of these exercises are like pelvic tilts, bird dog, like certain yoga poses.
Okay.
What's another thing? The other thing that's also really important is core strength, right?
Yep.
People are so focused on the pelvic floor muscles because it's down there, but what they don't realize, having a strong core also helps with bladder control because when you jump, cough, and sneeze, if you activate your core, you're actually keeping everything in place. So working out your core is also very important.
Good. Yeah. And just being healthy, right? Not smoking.
Absolutely.
Limiting alcohol.
We all know smoking's going to eat up your collagen.
Right. Yep. For beauty and for physiology. It's really important.
Yep.
Well, thank you so much. This was really enjoyable.
welcome.
Thank you. And I hope I get to see you again. Come back anytime.
Absolutely. Thank you.
Bye.